Hi, I'm Dave Esposito. I'm a board-certified vascular surgeon here at Milford Vascular Institute. And today we're going to talk about chronic venous insufficiency. So, venous insufficiency or venous disease is very, very common. It's somewhere between 35 and 40% of all Americans will suffer some form of chronic venous insufficiency, which makes it one of the most prevalent diseases in America. Chronic venous insufficiency, the symptoms can be leg pain, leg swelling, leg heaviness, varicose veins, discoloration of the legs where the lower legs become red or brown or discolored, ulcerations. There are a lot of symptoms of chronic venous insufficiency that people have, and the problem is people tend to just kind of ignore them and say, oh, I'm getting older, or it's because, but they can be a sign of a serious medical problem, which is chronic venous insufficiency. And what is chronic venous insufficiency? Basically, our veins' job is to take blood from our feet to our heart, okay? The problem is gravity, right? Gravity is constantly pulling the blood to our feet. So to get around that, our body, our vein have valves in them. So as the blood moves toward the heart, the valves close and the blood can't go backwards. It keeps moving to the heart. In people with chronic venous insufficiency, those valves are leaking. Why do they leak? Well, some people are prone to it. There's a strong family history. If people have family history of varicose veins or venous disease, they're more likely. Women are far more likely than men to get this disease, and that's because of the female hormones that circulate and can damage the valves, the trauma of pregnancy and childbirth, the stress those things put on the veins. Being on our feet, either standing all day or sitting all day, can put a lot of pressure on the veins. People who've had blood clots in the past, those veins get damaged. People who've had trauma to their legs in the past, the veins get damaged. So there's a lot of people who are prone to getting the development of chronic venous insufficiency. And again, once those symptoms arise, the problem is that they're going to be progressive because gravity never stops. So they will keep getting worse and worse and worse until a treatment plan comes up with. And typically what happens is if you have these symptoms and you come into Milford Vascular Institute, typically what we do is we'll do an ultrasound. An ultrasound will show us, one, make sure there's no blood clots, and two, we can look at the veins and we can test them and we can see if they're leaking. And if they are, then we could come up with a treatment plan to stop this. Typically, the first step is what we would call conservative therapy. Okay, conservative therapy consists of leg elevation. Okay, so basically when you're not working or being active, keep your legs elevated. Second is increase activity. The best thing you can do for your veins is walk. Okay, the muscles in your calves will actually pump the blood out of your legs if your calves are working. So when you're walking, you're actually pumping the blood, as opposed to when you're sitting here like me, the blood is just pooled in your legs. So walking, very important. And the third thing is compression, okay? You want to wear compression stockings as much as possible. Here in Milford Vascular, we'll fit you and measure you and get you the perfect size stocking, and you wear it basically from the morning to night. If you do that, your legs will feel great. The problem is, it's hard to get people to do that, right? It's hard to wear a stocking every single day. So typically what happens is people fail those conservative treatments. But the good news is in the last few years, there's been, probably in the last 15, 20 years, there's been a revolution in how we take care of people with venous disease. We have many options now where we can, here in the office, go in there and fix those leaky valves, okay? Keep the blood from leaking, decrease the venous pressure, and cause those symptoms to improve almost immediately. And with those simple, minimally invasive procedures that are all covered by insurance, and they not only get the patients feeling better, but they'll reverse the process and prevent progression to more serious problems, because chronic venous insufficiency left untreated can lead to more swelling, development of blood clots, development of ulcerations, where the skin can actually start to die. And once you get into that process, it's much harder to reverse. So our goal here is to try and treat these patients early and get them back to normal before damage is done that's irreversible. So, if you have symptoms of leg heaviness or cramping or swelling, or you have any concerns about the way your legs look, varicose veins on your legs, it can be a sign of a more serious problem underneath. So the best thing to do is come in, get it checked out with a simple ultrasound, and we'll be able to help you either rule something out, or if it's there, get you on the road to recovery. So give us a call if you need us. We're here at Milford Vascular Institute.
To schedule a vein consultation with one of our vascular specialists here at Milford Vascular Institute, give us a call today at 203-418-7386, and it will be our pleasure to care for you.